For the first time in over a century, some of Greater Manchester's municipal powers are clicking back into place. When the city's clocks tick to midnight tonight, £6 billion of health and social care funding previously administered in London will be directly controlled by the 10 local councils that make up the combined authority.
But Greater Manchester is planning something truly radical. The health and care cash will be spent not according to the priorities of Whitehall departments, but on whatever it's felt will improve the well-being of people and places here in Greater Manchester. And that could mean that some of the cash is diverted away from hospitals and doctors and into things like improving housing, jobs and public transport.
Greater Manchester is abandoning the Whitehall model. Instead of protecting their own budgets and power, organisations will, it's claimed, work together for the common good. So here at Stepping Hill Hospital in Stockport, for example, Chief Executive Anne Barnes says she'd be delighted to see her money going down.
Some of the budget that is funding this should actually be used by other institutions. And yes, we're in it together.
You'll give up some of your budget, would you?
We will absolutely give up some of our budget to allow social care to keep looking after people in their homes instead of them coming in here.
Life expectancy in parts of Greater Manchester is among the lowest in the developed world, and demands on the NHS and social services are rising fast. So even with a £6 billion annual budget, they must somehow save £2 billion by 2021 to break even.
OK, everyone, badges off. Badges off.
The answer, they believe, is to smash the silos. The institutional badges are being removed, literally.
It's that different thinking, isn't it? Thinking outside of your structure, your policies and procedures.
In the Plattbridge neighbourhood of Wigan, agencies trying to improve the well-being of residents, health, police, housing, council, all pool their budgets and their resources for the good of the place.
This isn't about multi-agency, this isn't about partnership working, this is about us coming together with common outcomes, the main one being that we're improving the lives of this area and this community that we serve.
Who takes the credit then, if it goes well?
We all do. We all do.
Really?
Yes, absolutely.
I'm very conscious of the fact that...
And what happens if it all goes wrong? Who takes responsibility if a hospital won't hand over some of its budget to social care?
We don't see ourselves as competitors, we don't see ourselves as organisations.
But giving money up on their budget? Why do you think that you can make this work?
People will be round the same table saying, look, in the end, what is good for the service we're trying to provide? What is good about local delivery? What are we all here for?
It's hard not to raise a sceptical eyebrow, but Greater Manchester's not just taking the money, it is rethinking how the state can deliver services and improve people's lives. If they can achieve the ambitious health and well-being targets they've set themselves, it may change the way we're governed. Mark Easton, BBC News, Greater Manchester.